When I'm feeling unwell, sometimes I'm not sure if I need to see a doctor or a nurse or a pharmacist. I just know I need help and advice. I think the idea of a family doctor might not be possible nowadays, but instead it's now a family of healthcare professionals, along with advice and tools to help us stay well. It's a whole team of experts working together to help people like you and me.
There's now a real variety of services rather than just seeing a GP and a practice nurse, but there's all these other sort of services that we offer within our network.
Still mobile, but she is mostly bedbound.
We are all in each other's rooms constantly. We are one team of healthcare professionals.
Sometimes you might be supported by more than one team member. You might start by seeing a nurse, and then they might suggest you speak to a social prescriber.
I understand that patients often want to see their doctor because they feel that they need to see a doctor, but often we are able to see, diagnose, treat, refer in exactly the same way that a GP would be able to.
We have a toolkit which is very useful in guiding our patients to see the correct person, be it Pharm Refer, MSK, a GP, nurse practitioner, whoever.
A lot of the time it isn't just your sort of clinical needs that you need support with, so you don't necessarily need to see a clinician to get support with that. For example, someone that's struggling with their finances might need support that's affecting their mental health, and my team can help with things like that.
If through an e-consult they had reported some falls that they'd been having, that had come over to the frailty team, who's triaged by myself, make sure that somebody's booked in to go and see them. They'll go and assess what package of care they're getting.
If there's a cause caused by medication, it's something that we can look after and we can put right rather than having to wait for a GP appointment.
When we review the medication, we can have that conversation. How are you feeling? What medication are you taking? Is that working for you? Do you like them? Do you prefer something else?
So my role is being able to build that relationship with that patient and build that trust and that confidence where the patient can call reception and book an appointment with myself.
More often than not, ourselves as physios are the experts at musculoskeletal.
So one patient who was referred to me was with a restriction in her shoulder range of motion. When the patient came into clinic, I quickly identified that I did not feel that this was a musculoskeletal presentation and actually ordered her a chest x-ray. That, with her weight loss and some blood tests that I organised, actually picked up that she had a lung cancer.
Traditionally, a GP would look at the medical health and the body and how they can solve that with medicine, or how they can solve that with a hospital referral if needs be to somebody else that can look at it with medicine. We are looking at it as what else is impacting on their health.
Our frailty team are all about sort of proactively looking after our patients, and we will go and visit the patients, for example, have a look at their sort of whole social health environment and see what we can do to improve them from there.
Digital tools are also helping people manage long-term conditions from home, like high blood pressure and diabetes, while still staying closely linked to their practice team.
So when we're talking about digital healthcare tools, we're primarily talking about apps that you would see on your smartphone. Within my role, what I'm really looking to do is to improve the patient journey and to ease the burden on the staff working in GP practices. And the introduction of these digital healthcare tools can do both of those things.
If digital healthcare is for you and it does work, there are lots of different ways which we can help you out.
General practice is changing. You might see different team members now, but this means that care is more connected, more supportive, and more focused on you. It's about better care from the right person at the right time.